How do Milan criteria determine liver transplant eligibility? Imagine trying to decide who might benefit most from a liver transplant when dealing with liver cancer. The Milan criteria help doctors make that tough choice by focusing on tumor size and number. These guidelines are used mainly for patients with hepatocellular carcinoma, the most common type of liver cancer. They look at how many tumors are in the liver and how big they are. If a patient has just one tumor that is 5 centimeters or less in diameter, they might qualify. Alternatively, if they have up to 3 tumors, each no larger than 3 centimeters, they could also be eligible. Another important factor is whether the cancer has spread outside the liver. The Milan criteria requiring no evidence of metastasis, meaning the cancer hasn't moved to other parts of the body. They also check if major blood vessels in the liver are involved. If the tumor has invaded large blood vessels, the chances of a successful transplant decrease. These restrictions are based on research showing that patients with smaller, fewer tumors tend to have better outcomes after transplant. They are less likely to experience cancer coming back, which is a major concern after surgery. The goal of these criteria is to select patients who will benefit most from a transplant while reducing the risk of cancer recurrence. If a patient's tumors are too large or numerous, doctors might suggest treatments to shrink or control the tumors first. This process is called downstaging. If successful, the patient might then meet the Milan criteria and become eligible for transplant. While some experts believe the Milan criteria are quite strict, they are still widely used around the world because they help predict better survival rates. Others have proposed expanding the criteria or considering tumor biology and how well the cancer responds to treatment. But for now, the Milan guidelines remain as a key tool in deciding who should get a liver transplant for liver cancer. In summary, the Milan criteria determine liver transplant eligibility by setting clear limits on tumor size and number, ensuring the cancer hasn't spread outside the liver or involved major blood vessels. These guidelines help doctors identify patients with the best chances of success and long-term survival after transplant. If you or someone you know is facing liver cancer treatment options, it's important to discuss these criteria with a healthcare professional to understand the best approach for individual circumstances.